Bismillah wa salatu wa salam ala Rasulillah. I would like to welcome everyone to tonight's webinar on the coronavirus throughout the Caribbean, inshallah. This is our second webinar. We had one 2 days ago, and it's amazing that in 2 days' time, how much the data has changed and how much more we know about the changing situation in different parts of the world. So what I have here is I have a little presentation on, firstly, about the Caribbean Muslim Network for those of you who may not be familiar with it. So it's a non-governmental organization established in 2017, administrative office in Trinidad, and what we hope to do is to network with Muslim organizations and academia in over 35 different Caribbean islands speaking multiple languages, including English, French, Spanish, and Dutch. And our aim is to facilitate sharing of information, education, training, and collaboration in areas which are relevant to Muslims and public policy on the various islands. In terms of our vision again is about trying to produce a unified network for Muslim organizations and individuals. And the idea is to try and collaborate with Caribbean organizations involved in social and educational programs to promote the development of inclusive, balanced communities and nurture civil society. Our core values remain that of integrity, teamwork, respect, tolerance, and professionalism. And this is just a slide that shows some of the key goals of the Caribbean Muslim Network: networking, research, education, and training, and some of the things that we involve, inshallah. There is a structure to the network, a secretariat, island representatives, and many of you are our representatives, and then project leads as we get on to doing a lot of work in the Caribbean region. And this is the current committee and its members, inshallah. Now, I want to start off today, inshallah, by looking at an ayah from the Quran. And this ayah in the Quran, in Surah Al-Baqarah, Allah tells us, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. And often when we read this ayat of the Quran, we think that it refers to someone else. And it's, subhanAllah, all of a sudden we find that all of the things that this ayat of the Quran talks about relates to us. That Allah subhanahu wa ta'ala is placing us through a trial, and it is involving a number of things which we all can see in front of us. There is a sense of fear, there is panic buying, there is people stocking up, there is people, there is a will service going around, people trying to write their last will. There is hunger, the poor, there is a loss of job, loss of property, people are dying and losing their earnings, there is no job. So all of these things that we can see in this ayah of the Quran is coming through, and we can see it all together in our lifetime. And Allah tells us that وَبَشِّرِ الصَّابِرِينَ. But in the midst of all of that, if we are to come through, inshallah, and we are to remain steadfast, inshallah, glad tidings will come for those of us, inshallah, who remain steadfast. And then the ayat of the Quran continue, الَّذِينَ إِذَا أَصَابَتْهُمْ مُصِيبَةٌ قَالُوا إِنَّ لِلَّهِ وَإِنَّ إِلَيْهِ رَاجِعُونَ. That when a misfortune or a challenge comes to you, what do you say? You say, we remember and we go back to Allah subhanahu wa ta'ala. We turn to Allah subhanahu wa ta'ala. We remember that we are from Allah. It is to Him we belong, and to Him, inshallah, we will most certainly return. So let's come to the coronavirus for those of us. I'm sure that there's a lot of information out there on social media, but I just want to stick to the facts in terms of what exactly is this thing that we are facing. And the coronaviruses are named because of their shape, because of their crown-like spikes on their surface, as you could see on the picture. There are 4 main subgroupings of coronavirus: the alpha, beta, gamma, and delta. And the set of viruses, the first time it was first identified was in the 1960s. And since then, we've seen 7 coronaviruses. You have the alpha, the beta types, and then you have, within recent decades, we've seen the MERS, for those of you who remember the Middle East Respiratory Syndrome, and the SARS, the beta coronavirus, which caused severe acute respiratory syndrome. And now we have the COVID-19, which really simply means the coronavirus of 2019, because it was first diagnosed in 2019. So those are some of the important things to bear in mind. Now, as far as the COVID-19 is concerned, it's a global healthcare crisis declared by the WHO as a pandemic. And what this means that the disease itself is not endemic. It's not something which is not spreading, but rather it is spreading, and it's spreading very quickly to nations and communities all over the world. And it seems as though within a very short space of time, there would not be a corner of the earth where this virus will not be present. And so therefore, all 7.8 billion people who live in the world are vulnerable to this disease. It doesn't mean that if you see a figure of one in your country, it means that you're not vulnerable. You are vulnerable. So it is the most dangerous pandemic in our lifetime, and it may well be, and that this might be the only pandemic that we might experience in our life. It's a novel coronavirus, and novel means that it's not that it's fantasy, or it's but novel means that it's something which is new, and it's new means that we don't understand the virus very well. We can predict some things based upon previous coronaviruses, but we don't understand the virus, having emerged, as we know, from the Chinese city of Wuhan in 2020. Now, the virus is an equal opportunity infector, which means that it doesn't matter who you are, black or white, whatever nationality you are, whether you're rich, whether you're poor, you're equally susceptible to this virus. So far, as we know, it's killed over 13,000 deaths so far, with 311,000 cases in 177 countries, and that is quickly changing. In a couple of days' times, these figures will be quite different. The current epicenter of the virus is Europe, but the current epicenter of the virus may well change to other nations, and is yet to be seen in the coming weeks and months. Now, I just want to go back to this idea of pandemics, because pandemics is something that we've seen over the centuries. And one of the big ones was the Black Plague in 1346. And this one, was the estimated death from this one alone was something between 75 to 200 million people. And believe it or not, the Black Plague is still existent even today, but not to creating the havoc to that extent. But sometimes in certain communities, it does come about again. Now, the most recent pandemic that we have experienced is that of the 1918 influenza pandemic. It was the most severe pandemic in recent history. It was caused by the H1N1 virus, or often described as being a bird flu. At that time, 500 million people, or 1/3 of the world population, became infected with this virus. And there were 50 million deaths worldwide. And all different age groups, paid the price for this. And what's interesting at that time is that there was very little in terms of intervention, in terms of pharmaceutical intervention. So therefore, the only means by which they can control the virus was through isolation, quarantine, good person hygiene, use of disinfectants, limitation of public gatherings. And this was unevenly distributed among different countries, different nations. And what we are seeing now with this new virus, we've been asked to do exactly the same. Because as far as pharmaceuticals are concerned, there is no proven pharmaceuticals against this particular virus, despite the claims of President Trump. Hopefully, inshallah, the hope is that we will be able to quickly develop vaccines and interventions that will be able to help. But all we have at the moment is supportive care. Now, when we look at this pandemic, we see that it started in China, but it has quickly spread to most of the world. When we look at our own region here in the Caribbean, and these are some of the latest figures, we can see that if we looked at this 2 weeks ago, the only island that had a couple of cases were Dominican Republic and Guadeloupe, and I think Martinique. But now look at the picture just after less than 10 to 12 days. It has rocketed, where we are starting to see more and more cases. and the number of cases will certainly be far different when we look at it perhaps in a week's time. So there is an exponential rise of cases that we will see. And part of the reasons why we may not have been able to see as much cases in the Caribbean is because of lack of testing. We have limited testing equipment and limited testing cases, and therefore many countries are not doing as much testing as perhaps as they ought to. It all depends upon governmental decisions, as well as unrest in places like Guyana and so forth. Um, this is up-to-date figures in terms of the countries and the number of cases that has been diagnosed, as well as the number of deaths. So in terms of deaths, it's quite small at the moment. It's just about 11 deaths, and there's about 365 cases. But it certainly will increase quite substantially in the coming days. Now, in terms of the symptoms that we can experience, we know about it. It sounds almost like a flu. You know, you have a fever, you have a bit of breathing difficulties, and then you have a dry cough. But what is different about this particular COVID-19 is that over half of all the carriers so far has been shown to have no symptoms, absolutely no symptoms. So it means that these people are silent, and then they're going about. And more so, what is interesting is that many of the children are not exhibiting symptoms or very mild symptoms, and therefore they can easily become carriers, and they are carriers, and spreading it to the adult population. The other key thing about this particular COVID-19 is that it is 10 times more virulent than the flu. So it is not the flu. It is very different from the flu. And this is the problem that some communities have. They do not understand why it sounds like the flu. Why are we treating it like this, and why are we giving so much attention to it? Now, I want you to have a close look at this particular graph, you know, between flu and between COVID-19. What you can see is that in any one particular year, that 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 the flu will affect quite a lot of people and will cause the demise of people, especially those who are elderly. But if you were to compare that now with COVID-19, you can see that there is quite a large disposition towards people who are elderly. And the reason why is that there is a correlation between people who are elderly and their comorbidities. People who are elderly have a decreased immune system. They are unable to mount an immune response that is required to be able to handle this particular virus. The other things is that if it is that you have chronic ailments like ischemic heart disease or hypertension or diabetes, you will find, or you're immunocompromised somewhere because of cancers or other types of conditions, you would find that the probability that you will suffer adverse or even death from this is quite high. And this is why the adult population, especially the elderly population, has become so vulnerable in this. Now, I wanted to mention some of the key things that have been mentioned about this particular things in terms of what we should do. And there is something called social distancing, and we've been asked that to maintain something like 6 feet away from each other. And the reason for that is very simple. It is because if it is that you are further away, then you're less likely to begin to infect other people. And I just want you to show you this maths behind social distancing. If you are one person, then the statistics are that you would probably infect about 3 people. Every one person who has a virus infects 3 people. If that same cascade continues, and with each of those infecting others, within 30 days, you have something like 406 people being infected. But however, if you were to have 50% less exposure by social distancing, then the number of people that you can infect goes down to perhaps 1.25 to 15 people in 30 days. And you can see that even if you were to have 75% less exposure, it goes down to just 2.5 people. And that's the whole idea between social distancing. And here you can see another graph which exhibits, the importance of social distances. Now, the problem is that at the moment we are with where the red line is, that that red line which is keep on going up exponentially, that's where we are, is because we have not been able worldwide to begin that process of really hammering the importance of social distancing. And this will come up again when we look at the way that communities are dealing with this particular crisis. Now, the other thing which everybody has been hearing about in the news media is that of something called flattening the curve. Flattening the curve. What does flattening the curve has to do with? Flattening the curve in over time may well end up to be the same number of people who may be infected. But the idea behind flattening the curve is that you want to reduce the spike of cases. Now, this dotted line that you see running across horizontal line, that represents the capacity of any healthcare system to be able to cope with the number of cases. And then you have that spike of the number of cases. So it means that once the spike goes above that flattened line, it means that your healthcare system is no longer to cope with the number of cases, and therefore patients be left with substandard care because the healthcare system cannot cope. Now, currently, for instance, in the UK, today guidelines have been issued about how to be able to differentiate which patient to save and which patient to give just simply palliative care and allowed to die. I mean, these are very hard healthcare decisions. These are really hard decisions that doctors must make. But this is the situation we find ourselves now, and we saw it in Italy, whereby people who are over the age of 65 and had comorbidities, they were not considered to be people who would be able to survive, many of them, and therefore they were not prioritized in healthcare, and a lot of them, passed away. However, if you were to flatten the curve as such, you can see and heed the advice of social distancing. What will happen is that over time the number of cases will decrease, and that will allow the healthcare system to be able to manage with the number of cases and provide the best possible care that we can at this time. It may well mean that the total number of cases will remain the same, but the ability of the healthcare system to cope would be better. Now, this curve is different for every different country and every different island in the Caribbean, because one is about our healthcare system, about our capacity and how much each of our hospitals will be able to manage, how much intensive care beds that we have. And I'm going to show some of this, inshallah, shortly. So we've been asked that if it is that you exhibit symptoms which even may sound like a flu, that we need to do something called self-isolation, which simply means that we need to be careful when we're coughing, washing our hands. If we live in a household, avoid sharing household items, cleaning, using disinfectants, and staying away from people. So those are the things that we all know of. So let's come now at the healthcare facilities that we have here in the Caribbean. Now, if we were to take, as an example, Trinidad and Tobago has several main hospitals. The main one being in Port of Spain. You can see the picture up there, but you have others as well: San Fernando, Mount Hope, Cova, and so on. But even if you were to look at, and we looked at all of the different intensive care beds and HDO facilities which are available in Trinidad, and the number is nothing, is roughly between 60 and 70, and this represents number of available beds which are available to be able to treat the entire population with all conditions. So these are not beds which are empty waiting for patients to come in. These are beds which are already occupied, and now you're going to burden the healthcare system even more. And this is why that line which says, the capacity of the healthcare system in the previous graphs comes into being now. It means that the number of cases that you can take care of at any one particular time is limited. The other thing is about not just the number of beds, it's the number of trained staff, the lack of equipment, and the lack of respirators. And we can see here that even in the UK, even in the most industrialized and wealthiest nation in the world in terms of United States, are suffering because they do not have the required equipment. So you can imagine what Trinidad and Tobago and many of the smaller islands will be like. So of concern to us here, and a lot of us will be talking about this in our presentations, is about, why are we concerned about mosque? Well, mosque is a center of our communities for Muslims, and therefore it is the one public space that we have complete control over. And many of us here are leaders of these mosques within the Caribbean region. Why are these mosques harboring grounds for this particular virus? Well, one is that they are crowded areas and confined spaces. There is air conditioning. There are many of them are carpeted. There's wudu facilities for sharing of droplets. There are toilets. There are prayer mats, and then there are ritual practices that we all do in terms of close knit rows when we pray, the hugging, shaking of the hands, and also living. So all of these things makes it, the whole idea of social distancing and trying to avoid contact, we can see goes out of the window. It means that, that we are very much susceptible and far more susceptible. And just to give you an example of this, I just want to, one of my close friends I was speaking to today, who is a Jew, attended a ceremony recently, and there were 400 in a congregation of 400. They did not know that some of the people, at least one of the persons in that gathering, had the coronavirus. And that person was engaging with everybody, shaking hands, hugging, and what have you. Since then, there have been many cases which have been diagnosed with the virus, and 2 people over the last week has died from it. And this is important, when you did, and therefore we need to be thinking carefully about the decisions that we make. We may think that our island only has one case, so therefore we can keep our centers open. But if you do so, then you're putting people in harm's way. And the question is, at the end of it, if somebody dies or somebody becomes severely ill, and it's not just about whether you die or not, we still do not understand very well the consequences of this particular virus. We know that many people will be left with something which is known as pulmonary fibrosis. Pulmonary fibrosis simply means that they will lose their lung capacity or some of their lung capacity. Sometimes people are estimating up to 10%. What this means is that you would end up with long-term respiratory type problems. So these are some of the, unknowns that we are not about. Now, before we go into our discussion, I just want to give you that when we think about our faith and we think about Islam, Islam is about a thinking faith, and Islam is something which allows us to be able to help us live our life. It is really about living and about trying to help people to navigate their way so that they can live a life which brings benefit. And if we look at 7 core principles of Islam, we know the harm aversion principle, that we must not harm others, nor should we put ourselves in harm's way. So anything that you do, any decision that you make which can lead to the harm of others, it is very much against the very root of what we are as Muslims. The prioritization principle, averting harm takes precedence over taking benefit. So you might be thinking, I can get extra thawab or reward by going to a mosque and praying. But if you do so, and you put yourself at harm's risk or you put others at harm's risk, then we think, well, some mosques have taken the decision, well, we would only take the fit and healthy to pray. But what happens when the fit and healthy go home and they begin to spread the virus to the old and elderly in the family and the infirm? So have we taken that into consideration? The mercy principle, averting harm from everybody, is an absolute priority. That is what Islam is about. Facilitation principle, hardship engages facilitation. We know that simple things. If you were ill, then you don't have to fast. You can postpone your fast. You can feed someone else. You can, if it is that you're on a journey, a simple thing like a journey, there is so much facilitation in terms of your prayer. The level of gravity principle, necessity takes precedence over needs. The self-preservation principle, do not destroy yourself with your own hands, rather do good. If you know that you're going to harm's way, why would you want to go into something knowing that you may well suffer the consequences? And then the contagion principle, do not go into space where there is a plague or come out of it. We know that what our mosques are like in the presence of such an epidemic. And it's very sad that when you look at communities, especially in places, even in places like the UK, we think that Muslims understand. Up to on Friday, even though we have such a dire emergency, up over 85% of the mosques were open. And it seemed as though only when government legislation comes down, then Muslims wake up and then they try to weasel the way. How can we bypass legislation so we can do what we think is right? Um, so we've been asked to close all public spaces. We've been asked to, everybody must stay at home, to avoid physical contact, to wash our hands and to do all the other things, and to make dua and ask Allah subhanahu wa ta'ala. And these are some of the practical things that we can do. And if we do it, inshallah, and if we maintain that sense of quarantining and social distancing, then we can begin to control this virus. Now, I just want to leave us with the hope, because we are people of faith, but also we are people who are filled with hope. And someone asked in the last webinar, when will this outbreak end? And when will life become back to normal? When can we go back and do exactly what we want, what we've been doing all our lives, going to our massages, praying, going to the beach, going to visit our family and friends? When is it going to come to an end? That's an unknown answer, but there are some requirements. And Larry Brilliant, who was one of the epidemiologists who was responsible for the eradication of smallpox, he did a brilliant interview, which many of you, if I can send you the link, you can look at it, you can read about it. But he says that what we need is 3 requirements. We need a vaccination, and the world is rapidly trying to find a vaccination. The faster we can find a vaccination, the faster then we can immunize most of the world's population. And therefore, when people develop immunity, they will not be able to spread, and also they will be able to develop the antibiotics so that they will not be affected by the disease. And then the other thing is that we need enough people to develop immunity through infections. And some studies would tell you that talks about between 50 to 70% of the world population. If we have enough people develop infection and enough people develop immunity, then we can control it. And then the other thing is that this may also require permanently change our behavior and society, the way we eat, the type of things that we eat, the way that we socialize, the level of hygiene that we maintain in our communities. And I think our faith, Islam, allows us, and teaches us the way to be able to change and behave such that we would not, so we can help control some of these some of these infections, and like coronavirus. This is not the last time in the world that we will develop these things. There will be smaller outbreaks over time, but this may be the last time that we may see something like this, and we hope so, inshallah, in our lifetime. I just want to leave us with one hadith of Rasul Sallallahu Alaihi Wasallam from Anas ibn Malik, and everybody talks about it, that a man said, "O Messenger of Allah, should I tie my camel and trust in Allah, or should I leave her untied and trust in Allah?" And the Prophet ﷺ replied, "Tie her, kill her, wa tawakkal," that tie her and trust in Allah subhanahu wa ta'ala. And the trusting Allah subhanahu wa ta'ala is important, but tying her here means that we need to be able to rely on the people who understand what is happening, understand that this is a public health emergency, understand that the people who know about more than this thing and is able to guide us are the epidemiologists, are the scientists, are the healthcare workers. These are the people who would understand exactly what is doing, and their guidance is needed far more. They are the scholars that will be able to lend us to be able to make the type of decisions that we need to make in order to contain this, inshallah. So with this, I'll finish with this presentation, inshallah.